For those of you that don't know me, my name is Mrs. Godet. The school board is thinking about offering comprehensive sexuality education courses next year. So we've brought you all together as student council presidents to sort of test the course out and see if we should offer it. So I'm going to turn it over to Dr. Rachel, and she can tell you a little bit more about herself.
Of course, I had to bring along a few props to show you all. Okay, so we'll get to that a little later. Well, let's just dive into the information. Can somebody, anybody, tell me what HIV and AIDS stands for?
I think HIV stands for Human Immunodeficiency Virus, and AIDS stands for something with an A, then Immunodeficiency Syndrome.
Very good. That's one of the closest explanations I've heard. Not exactly correct, but let's go through it.
HIV stands for Human Immunodeficiency Virus. HIV is the virus that causes AIDS, which stands for Acquired Immune Deficiency Syndrome. The 4 fluids that most commonly transmit HIV are blood, breast milk, vaginal fluids, and semen. To get HIV, one of these 4 fluids that already has HIV in it has to get into your bloodstream. This can happen during unprotected oral, anal, or vaginal sex, by sharing needles, or during breastfeeding. You cannot get HIV from casual contact with someone that has HIV. Things like hugging, touching, drinking from the same glass as someone, those won't transmit HIV. HIV is also not transmitted by coughing, sneezing, or mosquito bites. HIV attacks certain T cells in the body's immune system, making it harder for one's body to fight off diseases. When HIV progresses into AIDS, certain diseases that would not normally kill someone, like pneumonia, take advantage of the immune system's weak state and can actually kill you. We call these diseases opportunistic infections.
I thought that once someone infects you with HIV, they have less of the virus, and because they give you some of theirs. Is that true?
That's such a good question, and it's a very common misunderstanding. No. When someone gives you the virus, they still have just as much of the virus in their body as they did before they have given it to somebody else. So that's absolutely not true.
If you think about it, HIV is sort of like a gangster, perhaps a smooth criminal. HIV manipulates the body's CD4 T cells and tricks them into doing things that they're not supposed to do while it attacks the body. Meanwhile, CD4 T cells produce more HIV and makes the body weaker and weaker and weaker. A smooth criminal waits till its victim is at its weakest point to attack. HIV does the attacking part by launching its biggest attack, aka the opportunistic infection. That's not cool at all.
What is the only way that you can 100% make sure that you do not contract HIV? Yes?
Abstinence.
Very good. Abstinence or not having sex with another person. That's the only way that you can 100% make sure that you do not contract HIV. If you are having sex, what's the best way to make sure that you don't contract the virus?
Rubbers, of course.
Okay. All right, great. Well, yes, condoms, latex condoms with water-based lubricant. So we've got male condoms and female condoms. How many of you have seen a female condom before, outside of the package? Okay, well, let's see. Let's look at one.
No.
Yeah. The hardest part is getting into it, right? Okay.
Why?
So,
I have one question.
you said it is rather large, but keep in mind that this has to coat the whole lining of her vagina.
Yeah, what's the most durable condom?
Every brand is different. If used consistently and correctly, they all seem to work very well. The problem is, a lot of people don't understand that when you're using a condom, you really do have to squeeze the tip. The tip is there for a reason. You have to squeeze the air out and then roll it down. What we find is a lot of people forget that most important step. Then there's air up under there, and then before you know it, the condom has actually broken.
Can you use a male condom and a female condom? Like, you know.
Very good question. Absolutely not. And because what will happen is the latex See, now the female condom is made out of polyurethane. So the latex will get onto the polyurethane and the two will, you know, kind of attract each other. And before you know it, this will be ripped out and then you could possibly have some tearing going on. So no, absolutely not. One condom at a time.
Yes. So you know how they have the whole ecstasies and they have the colors of condoms and the different flavors and stuff like that? Are those just as safe as the regular condoms?
I'm going to recommend that you all go with some of the more popular brands. Look at the date, make sure that it hasn't been expired. Make sure it hasn't been sitting in a book bag for a couple years because they do go bad. And really take your time to make sure that it's a quality condom.
One moment of 15 minutes can be a lifetime of anguish and despair. And so you should actually think about putting on a condom before you have sex.
When do y'all feel is a good time to talk to your partners about using condoms?
Before, maybe?
After. Before, after? Well, it's very important to have this conversation early on.
No, that's just stupid because you can't, okay, you're making out with a guy and then you stop, so hey, you had any STDs and how many partners have you had? No. And then if you ask a guy to use a condom, they're going to be like, no.
What if you're on a date and then y'all going back to the house and y'all really not expecting to have sex? And what if it's like, as people say, the heat of the moment? So you expect me to like, oh wait, we have to talk about sex?
I don't expect you to do anything, but what you have to realize, you have to expect HIV and other STDs to do their job when you don't. So it's really up to you because HIV doesn't care if you have that conversation or not. You know, it simply just wants to live in your body, and when you give it that chance too, I mean, it takes full advantage of it.
If a chick asks me about my past experiences and if I have an STI, I'm gonna be like, you think I'm dirty or something? You don't trust me?
Yes. It's not about a chick, you know, thinking you're dirty or she not trusting you. It's about a chick loving herself enough to respect, you know, herself and her body. And I only know about this because at 19 years old, I was diagnosed with HIV. And I found out I had HIV from a former boyfriend who I loved and who I trusted. I didn't have this conversation with him. We didn't talk about condom use. I didn't even ask him what kind of STDs he had. I didn't care. All I cared about was not making him feel like I didn't love him or I didn't trust him, and I didn't care enough about myself.
After you told your family and stuff about it, they treat you differently?
Yes, my family treated me very differently. After I found out, immediately I was forced to eat out paper plates, plastic silverware. I had to wash my clothes separately. I was shunned out of church. I dropped out of college because the stigma was so bad. I mean, it was as big as students not even want to do class projects with me. I had to eat lunch by myself every day. It was a point after my diagnosis that I was completely alone, to the point where my phone wasn't ringing, no one was texting me, and I was actually homeless, living in my car.
That's not fair because anybody can get it.
You're absolutely right. I most certainly agree, but the thing about it is people are not educated about the virus. People don't know how it's passed. They don't understand that you contract HIV through oral, anal, and vaginal sex and sharing needles. It's a lot of misinformation out there when it comes to HIV, and unfortunately, these people were not educated, and so they treated me based on what they thought they knew.
We shouldn't judge people because they have AIDS. Everybody's human, and you can give someone with AIDS a hug, or you can even kiss them or just touch them. Most people take it or they blow it out of proportion just every day.
You said how a lot of people think that, oh, it's just the gay men that get it, or it's just the white people that get it, or these different races, or they put a face on it like just girls in prostitution and stuff like that. When you come up as this beautiful black woman that you are and you tell them that, I do have it, I'm HIV positive, blah, 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 what is their reaction like? Do they say, oh, not you? Like, are they shocked or anything?
Yeah, they're absolutely shocked. I mean, a lot of people don't even think I have it. I think some of you all were shocked.
I didn't.
Still think you're lying.
I mean, it's the same reaction y'all had, you know. But, you know, I think it goes back to the misconceptions that people have of this virus, that HIV has a look, and that it is only a certain group of people. And oftentimes people forget that the HIV, the H in HIV stands for human, and, you know, that's all of us.
HIV, like, doesn't have a face. It can attack anybody.
anyone can contract AIDS, no matter if you're Asian or black or white, you can contract AIDS. And also anyone can have AIDS. You can just be sitting right next to them and you won't know. And AIDS, it can be a touchy subject, but in the long run, we have to talk about this and we have to get the idea out. Some days, do you forget that you actually have HIV?
No, it's never been one day I have not forgot that I was HIV positive. And the reason why I don't forget is because every day at 10 p.m. Eastern time, I have a reminder. I have to take 8 horse pills each and every night before I go to sleep. And I experience vomiting, nausea, diarrhea, an upset stomach. And not only is it a reminder that I have HIV, it's also a reminder that I have a preventable disease. And so I think about it every single day.
What would you say to like young girls, young females, like in high school like ourselves, that really have sex with a lot of dudes and just go around doing it with people that they really don't know, they'll do it just for some little petty reason and then don't think about getting tested because they'll think, oh, I don't need to get tested, I know this, I know that.
You know, what I have to tell all people is it takes one person one time to contract HIV. It's not about being promiscuous. It's about having one sexual partner. It always amazes me because people think you have to go to this person and get the H, you go to this person and get the I, you go to this person and get the V, and it all comes together, and that's how a person contracts HIV. And you know, that's not true. So I would say to any girl, any man who's sexually active, you need to be tested for HIV. You are at risk. And someone who's have multiple partners, then you're multiplying your risk for HIV. No one can infect you with HIV unless you allow it. Of course, unless you're raped, and that's a completely different situation. But, that's why I talk so much about responsibility in oneself, because you don't have to get it just because, someone wants to infect other people. It's truly up to you, whether or not you allow this person.
It's so much easier to tell your boyfriend or something, let's just use a condom rather than to just do it without one and worry about the risk or whatever, have to go get tested and be nervous and all this stuff. Even though you should still go get tested, but it's so much better to just come out and say, I think that we should do this, instead of feeling uncomfortable later when you have to live with the HIV/AIDS virus.
So what we're looking at once again is the vagina, the vaginal canal, and this is the uterus. The uterus is where a baby is carried when a woman's pregnant. These are her fallopian tubes and her ovaries. What's happening every month once you start your period is you're ovulating, which means that the egg is popping out and is available for fertilization. So when it comes to birth control, there are a number of options, and so you really have to spend time trying to decide which thing is right for you. We have the patch. You wear it on your skin for 3 weeks. For 3 weeks straight, it releases hormones directly into your skin. Then we have the ring. It's a little vaginal ring that you insert into your vagina. It releases hormones for 3 weeks. You take it out that 4th week to have your period. Then, of course, there's the pill. You take a pill the same time every day, and it helps prevent you from getting pregnant. There are so many different combinations of what's in those pills that some of the pills make the cervix mucus so thick that the sperm can't get through there, and some of the pills actually are just going to prevent ovulation. The other way that you prevent pregnancy is by actually inserting a device called an intrauterine device, or an IUD, you may have heard of that, into the uterus, and it sits in there and disrupts things so that there can be no implantation of a fertilized egg. Keep in mind that all of the methods that we talked about, none of them are doing anything for HIV or STI prevention. So you've got so many options when it comes to birth control that today there's really no reason to, have a slip up. I have to say that the pull-out method does not work, because keep in mind, even before a guy ejaculates, he's got what's called pre-cum or pre-semen, which is that little bit of fluid that comes out before he actually ejaculates. And that actually has not just sperm in it, but any of the STIs or sexually transmitted infections or HIV, there's a little bit of that in there too. So you gotta be very careful about that.
Wait. Let me make sure I heard you correct. You mean to tell me the pull-out method does not work?
You are absolutely correct, sir.
So you mean I can't get the timing just right? Just don't work?
It does not work. It is not effective. And I do not recommend that as a form of birth control or as a way to prevent yourself from contracting a sexually transmitted infection. So absolutely do not have sex until you're 100% ready, because once you do, there's no turning back. And as you can tell, a lot can go wrong in the process.
I didn't realize that you could get HIV the same way you could get pregnant. That would suck.
For any more information about anything that I talked about, you can log on to drrachel.com or you can email me.
And my website is www.marvelinbrown.com. And the name of my book is The Naked Truth, Young, Beautiful, and HIV Positive.
Hey, so how was the sex ed class?
Oh, it was good. Here are my teachers, actually.
Okay, so how did you learn?
Oh, I learned a lot, actually. I already knew that abstinence was the only 100% way to be sure that you don't have an STI, you don't get pregnant, or you give someone an STI, which would be really bad on your conscience because that's not a good thing. And they also told me that condoms are the next best thing.
Okay, so did they teach you how to
use condoms?
Use the condoms, right?
Oh, no, not this time, but maybe in the future.
Well, okay, well, this makes my job as a father a whole lot easier. Talk about condoms.
If I had this scene that actually happened when I was in school, or someone that actually talked to me about it, a lot of things wouldn't have happened to me with growing up. I grew up in foster care. We didn't have too much of information on safer sex and ways to protect ourselves from growing up. Actually, at the age of 14, I actually found out that I was HIV positive. And at the age of 16, I actually had my first child. At the age of 17, I actually got out and was able to get a job and do what I had to do for me and my child. But I just feel that if I had guidance in school, then at the age of 16, I wouldn't have been pregnant. And if I had someone that I can actually talk to at the age of 14, I probably wouldn't have been molested also. I was one of the ones that just said, you know, it never happened to me. And trust me, it doesn't matter how beautiful you look. HIV doesn't have a smile, it doesn't have a name, it doesn't have a face to it. It's just something that's in your body, and now it's in me, and I just have to do what I have to do to take care of myself. Right now, I'm actually 19 years HIV positive. I live my life normal. I work, I am in school, I take care of my kids. None of my kids are positive. Regardless if you don't have someone there for you or not, just listen and just take heed. Trust me, you don't want HIV. And if you do have it, trust me, you can actually live 19 years.